Welcome to the OT Dude podcast with your host, Jeff, the OT Dude. I was inspired to create this episode to educate the general public about what occupational therapy is and what occupational therapists do. This short podcast episode is intended to spread the word about occupational therapy. I encourage you to share this episode with your family, your friends, your neighbor, on social media, you name it. My fieldwork clinical instructors were really awesome, and one thing I remember one of them saying was, no matter where you are in your career, you will always be an advocate for the profession and educate others about occupational therapy. She felt it was especially important to distinguish the profession from, say, speech or PT or even nursing. I recently went to the dentist and we talked about why I was there. You know, what kind of needles he would be putting into me, what the procedure was about, what to take for pain control, and all that fun stuff. He then asked me what I did for a living. I told him I was an OT. He looked at me curiously and asked, okay, now what is the difference between OTs and PTs? I gave him a quick elevator speech before he proceeded to stab me with the lidocaine needle, and I couldn't talk for a few hours. So how would I describe what occupational therapy is to my dentist, or anyone for that matter? Occupational therapists help people across their lifespan to do the things they do that occupy their time, which is defined as occupation. Many people joke and think that occupational therapists help clients to find a job, which is natural given the context of the word occupation. But think of it instead as occupy. The American Occupational Therapy Association, or AOTA, defines what OTs do clearly. Occupational therapy is the only profession that helps people across the lifespan to do the things they want and need to do through the therapeutic use of daily activities, or occupations. Occupational therapy practitioners enable people of all ages to live life to its fullest by helping them promote health and prevent or live better with injury, illness, or disability. Here are some examples of what occupational therapists can do for the community. This is by no means an exhaustive list. An OT can be a lactation consultant for parents who are having difficulty with breastfeeding. An OT can work with children in their home or at a clinic to overcome sensitivities associated with autism. An OT can work in schools with students to help meet their yearly goals such as handwriting or to meet their milestones. An OT can work in mental health, both inpatient and outpatient settings, to help patients regain their confidence to live with others or even independently. In fact, OTs have a strong background in mental health. An OT can work with physical disabilities in rehab and help patients regain function in their activities of daily living, or ADLs, such as getting dressed, showering, or using the toilet. Yes, many of us already know how to do these ADLs, but think about how many people can benefit from OT after conditions such as a stroke, a spinal cord injury from a car accident, a fall from a ladder at work, and so on. So yes, OTs can help individuals return to work, as in the case with orthopedic injuries, but we are not just limited to that. OTs also specialize in many areas. OTs can work in hand clinics for hand conditions and injuries such as carpal tunnel. OTs can be driver rehab specialists who conduct on-the-road assessments for people who want to drive again. OTs can use assistive technology to bring advancements into our lives such as virtual reality, 3D printing, or through innovative smartphone apps, for example. OTs can even consult with other disciplines and companies for interventions such as workplace injury prevention. OTs are entrepreneurs, and many start their own businesses. OTs are educators. OTs can even be inventors. All because the foundation of occupational therapy is everyday function through occupations, or what we do. This gets me very excited to see where occupational therapists can take the field in the future. For example, hate it or love it, OTs are adapting and using technology such as telehealth to bring OT to our homes. Just as technology is a tool and not the answer to everything, there can be an appropriate use for it when used correctly. So you never know. You may one day need occupational therapy or encounter an occupational therapist. One of my favorite instructors from OT school made a good point about the importance of the profession. He said, I am teaching and inspiring you all to be competent OTs because one day I will be old and need occupational therapy myself. That pretty much wraps it up. I'm your host, Jeff, and this is the OT Dude podcast. If you're interested in a career in occupational therapy, a student, new grad, or just curious about what occupational therapists do, check out OTDUDE.com for more information. Thanks for listening, and I'll see you in the next episode.